Hello, this is Dr. Enrique Gonzalez. Don't forget that if you are with other people, please protect yourself and the rest of the humanity using a mask. Welcome to the 28th Latino Health Forum. This year, as you can see, we're doing it through the Zoom because the pandemic, we cannot be together. Hopefully next year, I mean, it will be terrible if not. Today we are going to talk about a very important issue that is food, because with the pandemic and the economical crisis, the hunger is being exacerbated in our country. Everywhere. So this wonderful panel that we appreciate that they taking the time to help us today. They are going to talk about increasing access to food, information, and technology, addresses health disparities due to the COVID-19 and beyond. Text Food and Text COMIDA relies on simple text messages software to deliver information about where to find free nearby food to individuals' cell phones. So in my experience with my own patients, I've seen, and sorry, I won't read the entire thing because our panelists will talk about it. My own experience with my patients is that sometimes they don't know that these resources exist. So it's wonderful that you're going to talk about it. So our speakers today start with Lilian Merino from the Redwood Community Health Coalition. Lilia joined the coalition in the fall of 2015 as a certified enrollment counselor, later transitioned to the role of program coordinator at the Redwood Community Coalition. Lilian has deep experience in meeting, training, coordination for this group of people, talking about health programs to the population. Currently, she's focused on developing and expanding community relationships to strengthen programs under collective impact framework. Welcome very much, Lilian. The next panelist is Gillian Haley from the Justice Wise. She's an MA, and Gillian is the Executive Director of the Justice Wise, where she works with social justice initiatives to address housing, health, and human rights that pretty much we have a big problem in this country. Ms. Haley leads the development of Text Food in partnership with Montserrat Archila, that is our next panelist. And they offer a bilingual platform to connect people who are hungry with food. As we were seeing yesterday, and maybe I'm wrong, but close to 25% of the food that we produce in the United States are waste when there are many people hungry. Finally, Montserrat Archila, that has been also collaborating with the Latino Health Forum. She has worked for St. Joseph's Health, Community Health Investment, formerly Community Benefit, for the last 15 years. Mrs. Archila has developed and implemented programs aimed to improving the health and wellness of our communities. Currently, as the school-based behavioral health lead, she actively works to support the school communities to build fluency around trauma and adversity in order to strengthen resilience, building and restorative practice at all levels. Sorry about my accent, but well, I've been trying to improve it. But as you can see and you can hear, we have an amazing group of young professionals that are taking the time to help through the Latino Health Forum. Welcome very much, and we will have some questions after every panelist, and then at the end, if we have time, we'll have general questions for all of them. Thank you again, and welcome to the 28th Latino Health Forum. So be comfortable, drink a lot of water, and It's going to be just very informative. So please have your ears ready. Thank you.
Hello, everyone. Everyone can see my screen, is that correct? Great.
Yes.
Hello, I would like to thank the Latino Health Forum for allowing me to present today. I'm always gracious when people let me talk about NorCal Resources because it's something that individuals really need. My name is Lillian Marino. I'm the Population Health Coordinator at Redwood Community Health Coalition. And I will be presenting my slides, and after I present my slides, I will have the chance for you to ask your questions right after. First and foremost, I want to give you a little background of Redwood Community Health Coalition. Redwood Community Health Coalition is a members health centers group that focuses on delivering access and quality of care to the underserved and uninsured population in Marin, Napa, and Sonoma counties. We try to deliver these access to care through three core strategies, and one is value-based care delivery, access and equity, and a strategic alignment. We also, as you can see, we pulled up some data. Most of our health centers serve about 50% of their population is Hispanic or Latino. So this is a really great opportunity to show you that, you know, the need is there and we're here to help that specific population. One of the ways, well, what we do is, in terms of access and equity, which is what I'm going to focus on today, is we deliver resources through supporting our health centers with providing health insurance enrollment assistance and CalFresh enrollment assistance to their patients. So we've deployed what we call certified enrollment counselors in each health center to help their patients enroll into these programs. Additionally, we are trying to address the social determinants of health of the populations in our health centers. And we do that by, one, provide a health equity work group to our health center members. Two, we have deployed a standardized social need screening tool called Prepare. And three, we've adopted a online resource directory and referral platform called NorCal Resources. And I just wanted to show you that my little icons down here shows the most prevalent social needs from the screening tool that we've collected. You can see that right now at the time of 2019, the most prevalent need has always been food, housing, and transportation. So let me tell you about NorCal Resources. NorCal Resources is an online resource directory platform for food, health, money, any type of resources. People could go into the platform, look for resources for their specific zip code, or they can look for resources in their cities. NorCal Resources is the homegrown one. We've did a customized platform for North Bay because we wanted to make sure it was customized. It was a little more acceptable with individuals in the North Bay. And but we have a vendor called Aunt Bertha, and they are a nationwide resource database that powers NorCal Resources. So they're the ones that we communicate when we want to add a resource, or if they're the ones that review all the resources in the platform within 6 months. Every time they make sure it's up to date, make sure the resource is still available, and things like that. So let me tell you a little bit about the platform and how to use it. The platform right now is very easy to use. You simply put in the resource you want. For example, you could put, you're looking for food. So you could put your food resources on the find option, and then you could put in your state, city, or zip code and find it in that way. Now, since the health centers have a large population that prefers to have information in other languages, we made sure that the platform was easily available for those individuals. If you see on the corner on the top right box of the platform, you can see that it says select language. There's a drop down where you can select the language you prefer, and then the platform, for example, I selected Spanish, the platform automatically transitions into Spanish. So the platform completely becomes a Spanish platform for individuals. They can key in their words, keywords like comida, and put in their zip code, and they can easily find for that specific program in Spanish or whatever language they prefer. Now, once they find a resource, for example, food, since this is a webinar about food, if they find a resource on food that they feel like, oh, maybe I should go to this Food Connections by Redwood Empire, they can easily print this information. They can save the information. They can share the information via text or email, and they can do their own, they can do little notes on that specific platform. And the other thing that they can do is they can also refer themselves or friends directly through the platform. So they could always click on refer, and they can do that for themselves. And then lastly, I want to show you on the left, it shows you what it looks like for if an individual wants to email or text the program information to either themselves, or they can text it to another friend or a family member. Another highlight about the platform that I wanted to really share with all of you is, sorry, I kind of went back. Another aspect of the platform that I wanted to share with all of you is that we're able to look into some data from the platform. So for example, I'm gonna give you some data from prior to COVID-19 for just Sonoma County, which is what you see here. And this data collection, it involves two different users. We have the community. Whoever goes into the community themselves types in whatever they want. We have their data, and then we have the health center staff data. So we could see what both individuals have been looking for in terms of pre-COVID. And by pre-COVID, I'm saying that December, I really just selected December 1st through February 29th. That's right before it really happened to impact our community. And what I wanted to show you that login users is simply the users that have established their email with Aunt Bertha, and that way we can track what they're looking at. This login users could be health center staff or community member. Anonymous users are people that decided that they didn't want to log into the system and put their emails in. So those are, but they still look through the system, and they and you can see there's a lot of anonymous logged in users. Sessions, user sessions is how many times users went in. Each time they went in, they went into the platform and researched what they wanted to research. Actions is the number of clicks that a user used. For example, if they printed the program information, if they referred someone in the program, if they emailed someone the program information, or if they texted the program information. So average session time is the amount of time people are spending every time they go into the system. So you could see that at this time in minutes, people were spending about 6 minutes during December 1st and February in the system. So there was not, from this data, there wasn't really going on. People weren't really looking for things specifically in Sonoma County. So maybe it was because of the holidays, I'm not sure. And on the left side, you'll see the program search by category. So this means that the users on the left, we're looking specifically for health, food, and housing. So I wanted to highlight the food. The food at the time was about 24.5%. People were looking for that primarily around that time. So that's a good number for you all to remember, because I'm going to show you on this next slide. There's a huge difference. So I aggregated the data for March 1st to June 30th. So this is where there was a lot going on around this time, and this is where COVID really hit, and it continues to hit, but this is just the aggregated time that I wanted to give you guys information on. And as you can see, the logged in users went up, anonymous users went up, and the amount of sessions went up. So that means that people were going into the system 600 times, and the actions tripled. So that means that people are either referring or saving the program information, or they're sending or texting program information. So it tripled since March to June, and people are instead of only taking 6 minutes of their time to look into the system, they're actually taking 15 minutes to look for programs that they need. On the left side, on the right side, now the food jumped up 10%, and the housing also jumped, and other categories jumped. So during this time, you can see the need for these programs significantly went up. So during this chaotic time, and we continue to see, is that health centers are putting a lot of effort to share as many resources as they can with their patients. And a lot of the ways they're doing it is either they email resources directly through the platform to email, or text resources directly through the platform to their patients. They print the program, that's what I heard, that they print the program information and mail it to the patients as well. They submit referrals through the platform. So they're doing a lot. So at this time, you wouldn't believe this community. Sonoma County is amazing in many different ways. And one of the ways that we've been very successful in is combining, collaborating, and finding information. So the COAD, I'm not sure if you guys know, there's a Sonoma County COAD, and there was a lot of community resource meetings around the county. And then there was a lot of public messaging going around with resources for the county individuals. So what we heard from a lot of community members and a lot of the health center staff, but is that there's so much information and there's so much navigation that they have to do. How can we streamline all this information and we can combine it and collaborate? So we decided as a community to first, RCHC deployed a lot of staff into the Sonoma County, the community organization active in disaster, the Sonoma County COAD. We deployed a lot of staff members to join those groups and collect information. And then from there, we added it into NorCal Resources. So we made sure that the COAD information aligned with the NorCal Resources information. The next week, we asked 211, how can we get together and figure out navigation for these health center staff to really bring the information to their patients and navigate what's going on each program for their patients. And 211 graciously collaborating, continue to collaborate with us, and we now serve these health center staff, case managers, and community members in making sure the information is reflective on all of our platforms. And we decided to provide time for the healthcare teams in Sonoma County and give them what we call resource office hours. So if there's a person who's helping a patient and can't find the resources they need, or they can't figure out how to use the 211 or how to use NorCal or how to use any of these platforms, they come into Resource Wednesdays and they can ask all of us, not only 211 is there, but Buckaloo, First Five, and Partnership Health Plan. We also have St. Joseph staff member there to ask to also provide information for individuals. So we've kind of come together as partners to make sure that everyone has accurate and helpful information for them to provide for their health centers patients, or in other cases, case managers and their patients. Now, that's all I have for you guys today. I am going to open it up for questions, and I'm ready for all of you.
Perfect. Thank you, Lillian, again for that wonderful presentation on the work that you're doing here with NorCal Resources and all these wonderful collaborations. So we'll jump into the Q&A. Just so folks know, you can use the Q&A function at the bottom of your screen and submit your question there, or you can also use the raise hand function if you want to ask your question live. Okay, let's go with the first one. So we have one that we just got right now, anonymous attendee. How often is NorCal Resources being updated?
Oh, great question. The platforms is updated by a Aunt Bertha staff member every 6 months. But if you see something on the platform that it can't wait 6 months, you are more than, it's very easy to let Aunt Bertha know quickly through a suggest a change button on the either the program card or on the main page, and you can suggest changes. So not only is the Aunt Bertha staff making sure the information is accurate, but also the community is making sure the information is accurate.
Mm-hmm. Awesome. That sounds great. That's a really cool tool. Okay, so let's go with some questions some folks asked earlier. Another anonymous question: how is this tool being presented to organizations that serve the community in need? And how can organizations get added to this tool as a resource?
Oh, great questions. You know, I've been doing a lot of community outreach. So I actually did the Latino Health Forum last year. I went out and tabled there and shared information. And I've been out. I've gone to presentations for the Health Actions Forums. I've been going out there, but maybe I didn't go out to you. So you're more than welcome to email me, and I will make sure first, maybe your program is already in the platform. You may not know, because we really, the Aunt Bertha team really went through all the programs in Sonoma County to make sure that we have them in there. Additionally, if you were in the COAD information, you're going to be in that platform, in that information as well. So I recommend to email me, and I can even show you how to make changes to your program information and a lot of different things that you can use the platform for your own organization.
Awesome. That's pretty awesome. So let's go to the next question. I'm sorry if I'm moving a little bit quickly, but I want to make sure we get through some of them. So let's go with 2 more questions so we have enough time for the second half of the webinar. So we have a question from Ellen. Is there a way to know if the referral for services actually made a connection?
Oh, absolutely. When we when we looked at a platform, we want to make sure that referrals are not just going anywhere. So the platform, if it says refer here, it's because the organization has decided to take the referrals through the platform. So let's say you're a community-based organization that, hey, if someone receives my information, I want them to refer someone to me. First of all, you create a user login and then let Ampertha know you work for that organization, and they will make sure that you work for that organization by giving you contact information. And then once you establish a user login information, you can say, okay, you can click, people can refer to us. And then once you do that, people, if they go into the platform and see, oh, refer this patient or refer this person, they can easily refer to you, and then you can go back and log in and see all the referrals. Addition to that, once you establish your username, you will actually get an email from Ampertha saying, hey, look, there's someone that referred to you. So what do you want to do with this referral? Do you want to contact the individual? And then you would either click what you did with the individual, and Ampertha will ping back whoever referred to you that they got your services.
Wow, that's a pretty well thought out system. Wow, that's really good. Okay, we'll move on to this last question real quick. And just for folks, just so you know, I know we received a bit more questions, so we will send them over to Lily and have her answer them when she gets a chance, and then we will post those on our website. So just for the last one, someone's asking, are COVID-19 testing sites, information, etc., available in this tool?
Unfortunately, no. The reason to that is because they're constantly changing. So some of them close, some of them stay open. We still don't have that capability, but it's something that we are definitely trying to explore.
Mm-hmm. Definitely, yeah. I know how, like, sometimes the folks that would set up a testing site, sometimes they don't even know until a few days before, because everything is very sporadic, and we're constantly moving, right, to see where we can get these resources out to the community. So that definitely makes sense.
And we definitely will commute to the community if we end up doing that through the platform. But
awesome.
for right now. Mm-hmm.
Awesome. Well, how exciting. Again, thank you, Lillian, for your presentation. And then we will now move forward with Jillian and Monse and their presentation. So I will let you two take it from here.
Thank you so much, Pam. And Lillian, thank you so much for sharing that resource that we have in our county. It's just so useful for so many. My name is Monse or Montserrat, and I am part of the Text COMIDA team that is presenting to you now. And we're going to start with a poll question. And that question is, if you ever needed food, would you know where to access it? So hopefully you have a poll that's popped up on your screen, and we're going to take about 45 seconds to take this poll. And while I'm hanging out, I just want to say thank you so much for joining us today. We really appreciate that you are here. All right. So let's go ahead and close the poll. And Pam or Daisy, if you can help me with the percentages. Thank you. So of those that were able to vote, 83% of you said yes, and 17% of you said no. And what our hope is that at the end of this presentation, you will have another resource or tool in your toolbox to know exactly where to access free food when needed. I'm now going to turn it over to my co-host, Jillian Halley, and thank you so much.
Hello, thank you, Monse. I'm really glad to be here today. Thank you for having us on the forum here. And so my name is Jillian Haley, and I was the lead on text food until I met Montse, and then we became text COMIDA text food. And I'm so happy that that's the case, because I know that there is a lot of food insecurity in the Latinx community. My work was mostly with shelterless community members, and I believe that we need to work with the people in our community who have the most challenges, and that will help the whole community get healthier. So I was really excited to work with Montse to create this bilingual system that connects people who are hungry with free food. And this is an example of a community collaboration tool from the Sonoma Intersection System of Care. So I want to take just a moment and talk about Sonoma Intersections. You may have heard of them. It's a cross-sector coalition in the county, and Sonoma Intersections focuses on upstream solutions for housing equity. And then the system of care is an offshoot of that that focuses on human rights, equity, and our vision is a healthy community where everyone has access to the resources they need to be healthy and thrive. So we say that we envision a healthy community, and how do we build that healthy community? Well, we believe that this community cares, and research shows us that giving and receiving care enhances the health and well-being of the whole community, and that actually it is better, it gives more to the giver than the receiver sometimes. So our mission is to create tools that make it easier for neighbors who care to work together to solve tough challenges in their community. And with text food, the challenge that we were solving is access to food. And right after the pandemic hit, I started hearing about members of our community who were experiencing actual hunger, where they couldn't get food for days. And this wasn't common in our county before the pandemic. But with the towns closed and nonprofit volunteers needing to go home and shelter in place, there was so much turmoil that people didn't know where to get food. So one of the issues, you can imagine, if someone is shelterless, they might not have access to internet. And so how would they get information like that wonderful resource that Lily shared with us, the NorCal Resources? They wouldn't be able to go online, but most people have a cell phone, or they know someone who has a cell phone. So we knew that the solution had to involve being able to access information offline. And we were also hearing that this tool would be useful for a long time, even after the pandemic, because we were seeing unemployment rates going up. And this is information, actual data from Sonoma County. And you can see the light blue bar is last year in May of 2019, the unemployment rate was 2.4%. And now in May of 2020, it's 12.7%. So we're seeing a significant rise of people who have less income. And in addition of the job loss that occurred, 39% of the job loss affected those who earn $40,000 a year or less. And finally, one other statistic that we found is that hunger was up 10% in the United States from March 2019 to 2020. And then recently I saw an article in the New York Times that in May, it's up 25% now, about twice the pre-pandemic level. And of course, we're seeing that disparity in how much more, this is the average percentage, and then that it affects the Latinx and African American communities much more significantly. And I just wanted to add one interesting thing from that article. Sorry, thank you for putting that back. That they're finding that even though poverty is going down, hunger is still going up. And what they say, this New York Times article, is that it has to do with the fluctuation in income, because you have to eat every day and have income every day, where so over the year you might have enough money not to be considered to be living in poverty, but when your income fluctuates, you can still be experiencing real hunger. And now Montse will talk about how she brought to me the challenges that we designed for Text COMIDA.
Thank you, Jillian. So at the community level, we were also hearing and seeing challenges that our families were having to accessing food. And the first was transportation. With some of the sites, unfortunately, they weren't close enough for some, you know, like let's say a mom with 2 kiddos maybe had to walk some miles to get access to food. And that just was not available to her. Knowledge about closer and or other resources. And as we were trying to help these families, that is something that we were struggling with too. And now I know I have NorCal Resources that I can access as someone who's wanting to help a family access food. And there are other places, but again, thinking about someone's proximity to another resource, you know, takes a little bit of navigating. The other is working. So a lot of our families were frontline workers. So they were still on their jobs. And unfortunately, the distribution times or the days that they were seeing did not work within their schedule. So that was a bit of a challenge. How do you find a food distribution site on a Saturday, for example, and you have no internet? So you're not going to necessarily do an internet search. And you can see as I'm kind of going through these, why this partnership with Jillian has been pretty amazing in trying to address what we've been seeing. Finally, anxiety and stress. I know this may come as no surprise to a lot of you on this call, but it's really important to think about the anxiety and the stress around public charge that our families were feeling. Maybe not certain whether or not going to a food distribution site was going to put them at risk for being public charge. The other is immigration. We heard that folks maybe thought that ICE was going to be coming around, and so they didn't want to leave their homes. They just wanted to be inside, and in some cases relied on neighbors to pick up food for them if they were able. And the other was exposure. We have a lot of families living in multi-generational households, and so some were just staying inside because they did not want to risk getting exposed and then exposing the rest of their family. So, you know, our families did have unique circumstances that they were facing. And I'm so glad, again, that Jillian and I were able to come together to create something that was really aimed at addressing these issues.
So there you have the challenges that we were trying to solve. And now we're going to talk about the solution we came up with. And so the solution is a 2-part text-based system that connects food providers with people who need food. So part 1 of the system is about the food providers, and we curate the information about the various food providers, about the types of meals they distribute and the days and times, the population served, and the location of the meals. And that makes it simple when we put it in the database. It makes it simple to share that information broadly. And of course, it's important to get accurate information, so we update that database weekly. And Redwood Empire Food Bank has been kind enough to partner with us and share their updates. And that makes it a lot simpler to keep things updated. And then part 2 of the system is the texting software that we use. And we have a phone number that anyone with a cell phone can use and text the word either COMIDA or food, and they'll get a response that tells them where they can get free local food that's near them with no internet required, because you remember that was a design constraint of ours. Now, What if you don't have a phone? Well, we talked about that already, that you might maybe be able to visit a case manager or a service organization that could text for you and get that information, or you might have a friend that has a phone, but all you have to do is ask and they can text that number as well and pull up the information and share it with you. Some of the usage that we're seeing on our system has been really great to see that it's really meeting a need. So we started over here on about May 1st, where we had something that was built enough that we could give it to partners to test. So case managers and service organizations helped us test the early versions and improve it. And then here where you see there's the red arrow that says North County, that was, we first went, had text food working in Windsor, Healdsburg, Geyserville, Cloverdale, and tested it out there. And you can see people used it. And then a couple weeks later, at the end of June, we went live in Sonoma Valley area, and the usage and uptake there was a little more gradual. Then when we got to where it says Healdsburg utility bill insert, well, here's the thing, if you ever want to get information out, apparently that's a good way, because you can see this spike right here. Corazon Healdsburg got the city to include flyers in their utility bills. And we got this big spike. And then again, Corazon Healdsburg took flyers to the Healdsburg School District and asked them to distribute the flyers to their families. So that right now, the last time I checked, this is from, I think about a week ago, this graph, we're up to 450 users. It just keeps climbing. So it's meeting a need. Oh, and I forgot to mention, you can stay here, but I forgot to mention that about 50% of the users call or search and text COMIDA, and then I don't think I did that math right, but you know, we get half as many people that are searching text COMIDA as text food right now, but those numbers are increasing. That percentage is increasing. Okay, Monse, there you go.
So this system is 1 plus 2. So it's these two parts that Jillian just talked about. It is the database, step 1, and then the second part is the texting piece. Now, I know you're looking at this screen and you probably have cell phone in hand and you might want to start texting this, but I'm going to ask you to hold off for just a moment. We are going to do an actual live demo for you in just a minute. But what I want to talk about is the differences between text COMIDA and text food. And something Jillian mentioned to me in terms of the previous slide and the data is that she was seeing that a lot of our folks, Latinx folks, were searching for food on Saturdays and or Sundays. So thinking about that earlier challenge that we had talked about, that if someone is working Monday through Friday, 8 to 5, and are not finding the sites that they're needing available, it was really useful for them to know where they can get food on the weekends. And so as we were thinking of how we were developing this program, the texting the number 1 or 2, it's going to prompt you to select the days of the week. So number 1 would be Monday through Wednesday, and 2 would be Thursday through Sunday, so that you can access food on a day that you'd be available to pick it up. Now this varies a little bit from text food, and Jillian will cover that in a moment. But again, it's really easy to use. It's 3 steps. You text COMIDA, you choose the day of the week or the days of the week that you're interested in finding food, and then you text your zip code. And pretty instantly you get a lot of messages telling you where your nearest food resources are. So I'm going to turn it over to Jillian so she can talk to you about the different, like the nuances of text food.
Oh, the next slide is pretty similar to this one, but it says text food instead. There we go. Thank you, Monse. So again, to use parts 1 and 2 of our solution, you follow the 3 steps. Number 1, you text the word food to our number. Number 2, you respond with the number 1 or 2. And for text food, what you're selecting is number 1 means you're looking for meals. And number 2 means you're looking for groceries. And the reason for that is that I was in the beginning, I was designing for people who are shelterless. And you can imagine you don't have a stove to cook something on, you don't have anywhere to store food, you can't carry it around with you. So that population was primarily interested in meals. And so that's why there was that difference. And then the third step is to text your zip code so you can find food that's right near you that you can, is closest to you, so you don't have to travel too far. Back to you, Monse.
All right, next slide, please. Thank you. Okay, so as promised, we are going to try a live demo with everybody right now that is in this session. And probably one of the only sessions where we're going to tell you, please look at your phone. We want you to use your phone and text the word comida or food. It is completely up to you, whichever system you'd like to test, to the phone number 707-353-6333. And what you should know is that you will be receiving a hello message from Jillian if you are texting to food, and from Shalene Lopez, she'll say, hi, this is Shalene. If you're texting comida, Shalene is also one of the Latino Health Forum board members, and we so appreciate her lending her name for this system because she is very well known. All right, so once you text, you should have received a message from, it's a different number, that's what I wanted to mention. And then it will ask you to make your selection of 1 or 2. You've probably already done that now. And go ahead and enter your zip code. And while that's happening, you will start, like I mentioned earlier, getting resources populating into your text box. And just a reminder, so if you look over to the right while we're waiting for everybody to test the system, that we aim for accuracy. And again, just saying thank you so much to Redwood Empire Food Bank for being such a wonderful partner in helping us do so. The information provided gives you days, times, type of food, and other information that is on there is who gets served. So for example, seniors, if you're looking for specifically for meals for seniors, that will also be populated into your text box. So it'll tell you exactly who the food is for, if it's for families, kids, etc., where to go, the address, the phone number, and if they have a website, it'll also give you their website. So you have a wealth of information that you can take in one fell swoop and make decisions about where you are able to access food. And next slide, please. So we want to ask you, how was your experience? This is your poll question. Was using Text Comida Food a good experience for you? And we very much welcome your feedback, and we want to know, why was it or why wasn't it? So what made it a good experience for you? Feedback is really important in shaping the design of this work, and we want to hear from you. So feel free to fill out the poll. And while you're doing that, if we could go to the next slide, please. Almost there, thank you. And this is what people have been saying. So we do have interface capabilities on Text Comida and Text Food, and we often ask people if you need additional help, if there is something, resources that you have questions about, please email us, and you should have received that message on your text. And people will text us. And as you see on the screen, we had someone say, necesito comida, gratis por favor. Hola, mi nombre es, and of course we don't put in the name, necesito comida para preparar, gracias. So there's a ask about a specific type of food. The other one that is to the bottom right, buenos, me mandaron este número de teléfono para pedir ayuda. So people are using the system, and we so appreciate hearing from community to learn how we can continue to grow and make it the best resource that it can be. And Jillian, did you want to add anything before we go to the next slide?
No, this is great. Thank you, Monse.
Mm-hmm. And lots of thank yous. I want to point that out. All right. And that is the end of the COMIDA Text Food presentation. We greatly, again, appreciate your time in joining us today. And I believe we are going to be doing Q&A just specific to COMIDA Text Food. And then we will go to larger Q&A for everybody. Thank you very much.
Thank you, Monse and Jillian. So I do have the poll results. Would you like for me to stop sharing and send them over to you?
Yes.
Oh, nice. I can see them. Yeah.
Perfect.
Awesome. So thank you, Jillian and Monse, for that really lively discussion. I have always seen these kinds of programs, you know, where you are able to like text just like a one word to a number and get some resources, but really seeing how this functions and the different ways you were able to make it work for Text Food versus Text Comida, you know, from listening to the community and their needs. And I thought that was really ingenious, and thank you for the work that you're doing. This is such a great resource, and now everybody, you know, has access to it, and we even got to test it out, so even better. So we will move into a Q&A session. Again, for folks that joined in a little bit late, you can either dropping your questions down in the Q&A section at the bottom of your screen. You can also use the raise hand option and if you want to ask a live question. So we will be starting. So I did have a few questions that I pulled earlier. So the first question, anonymous, how has the COVID-19 pandemic impacted your Text Food Comida tool, if it has?
Hi, this is Jillian. We started designing the tool after the pandemic hit because we started hearing about people who were going hungry, starving, you know, not eating for days. So it was the impetus to create the tool.
Okay, thank you. We have a question earlier from Hannah. Has there been any discussion about deliveries of food to people who are mandated by the public health order to isolate or quarantine due to them being at high risk of having COVID and therefore, you know, not being able to leave the house?
I can take the first part of that and invite Jillian to jump in at any time. So some of our communities mobilized fairly early once we went into lockdown, Sonoma Valley being one of them. I gave the example of families who just wanted to shelter in place because of risk of exposure and so many other things. And so there is a group of amazing volunteers. Please, Jillian, correct me, it's Demetra.
Yes.
Who is in Sonoma Valley, who organized volunteers to start doing food delivery to people's homes. And so it's definitely not lost on us that this is something that folks want to know more about. And of the services or the folks that are providing food right now, there are sites that do distribution and delivery, and that would be noted in the actual text. So if you're looking for delivery, it will let you know this is a number that you can call. But Panna, to your point and to your question, part of, as I understand it, with the database piece is that we are wanting providers, just like NorCal Resources, to be able to utilize the system to put themselves in and let folks know that there is delivery that's available for individuals. And Jillian, feel free to add anything.
Yeah, that was good. I will just add one thing that we heard from a new organization in Petaluma. I'm trying to remember the name, but it's another group of volunteers that formed around how to support people who've been asked to shelter in place. And I'm just getting the name here. IsoCare in Petaluma. So you can Google that if you're interested in food delivery for people who have been asked to shelter for or quarantine for COVID. And
Perfect.
that's all I have to say. Yeah.
Perfect. Thanks, Jillian, for sharing that. We'll jump to the next question. So here we have another anonymous question. Has there been outreach to Santa Rosa City Schools regarding Text Comida or Text Food tool for families?
That is part of what I'll be working on in the next couple of weeks now with the school year upon us. My role with St. Joseph is working hand in hand with the schools. And so that is something that we have been talking a lot about. Because the system started in May, there was testing that needed to happen. We needed to make sure that the resources were available and open, because of course we don't want to send folks to a location where there isn't food available. And so now that we are newly county-wide and completely open, an open system, that is part of the next, kind of that next strategy of where to outreach next. We understand, especially for our families, that this is a really valuable tool that they could use. So the answer is yes. And not only just Santa Rosa City Schools, but any other districts in our county, or all districts in our county.
Definitely. Well, that's some exciting news, and I can't wait to see how that all rolls out. We'll go to the next question. So we have another anonymous question. I think this is going back to what you both were talking about when you saw like that, when you were showing the graph. So this is based on the uptick in users from collaborating with other orgs, which I think was like Corazon Hillsburg. Do you plan to collaborate more in the future? If so, with who?
Yeah, I'll take that question. The tool, it was created collaboratively. It doesn't belong to an organization. It was created as part of the Sonoma Intersection System of Care Coalition. And Justice Wise is just the lead organization leading the design and a rollout of the tool, but we've collaborated with St. Joseph's Healthcare System and with Redwood Empire, we already mentioned. Rebuild North Bay provided funding for the Text COMIDA portion of the design. And there are a lot of really caring people in the community who care about people getting food, and they helped us build that database that we talked about as being part one of the system, to gather all that information and make sure it's accurate and verify it. Some of the people even went to the site to like be sure it was there and talk with the people who were serving food. So it's a community collaboration tool, and it was built collaboratively and it's maintained collaboratively. So yes.
Awesome. Well,
and can I add just very quickly that, being able to do a live demo with you all, we're bringing you into our Text Comida family, our Text Food family. So you are also now stewards and partners in this work. And please share this tool with your agencies, the folks that you serve. So we are all part of this and in partnership.
Definitely. Well, yeah, it's great to be part of one whole big collaboration with the community. So that's great. We have another question here. What is the biggest challenge for the program Text Food, Text Comida?
Jillian,
we might have different answers. Do you want to go? Do you have an answer right now, Monse?
Early on when we were testing, as far as the Text Comida, we did go through some iterations about zip code and or putting the name of the city that you live in, and that was causing a bit of confusion. And so as we've been developing and reiterating the system, it's that community feedback has been really vital. So if anything, I think it's getting in the kind of in that habit of how the steps work together and just kind of practicing. And even for myself, I was a big tester, and I would say to Jillian, wait a minute, I did something wrong. So it was really great to be able to address some of those things in real time. And also the other, as far as Text Comida and I think we also found this with text food, that the response is coming from a different number. That's why I mentioned that during the presentation, just so folks are aware.
No, yeah, definitely. I'm glad you said that, because usually those kind of like become like a whole string of texts, and I'm glad I got to pop up and click on that different number. Made it a little bit more clear. So thank you for that.
If I may just add that
Mhm.
keeping the information accurate, I'd say that's going to be an ongoing challenge. You know, even having many eyes out there. So we really appreciate when people tell us if something's wrong. And I just saw a message from a doctor who works at ISOCare, the organization in Petaluma that I mentioned. And they pointed out that it's a county-wide program and they don't do food deliveries, but they help provide support. So I just wanted to throw that in. And thank you to the person who wrote that message.
Yes, thank you. I think that was Pana again, so thank you.
Okay.
Let's jump to the next questions. We have quite a few here. So do you plan to translate to other languages for other underserved communities in Sonoma County? This is a great tool. And do you know if other counties are doing something similar?
Jillian, do you want to take that one?
Well, I'll let Montse speak to the translation part, but yes, we've had inquiries from a couple of other counties, Napa County, and then we're also looking at Lake and Mendocino counties and San Joaquin County. So we have calls with them. They heard about the tool and wanted more information.
Awesome. That's exciting to see that this is spreading. So you both created a domino effect in a way. So
I hope it helps people get food. You know, it's just such an important basic need.
No, yes, definitely. And I'm glad the work is being done to, mitigate those gaps and stuff. So, Monse, I don't know if you wanted to speak to the other part of the question, which was about if there's a plan to translate to other languages in underserved communities in Sonoma County. So I'll let you take that.
I would really love to see that. And, the translation for Text COMIDA, it really just came from a passion of mine to make sure that the language felt good. That's why, we asked the question, what made the system work well for you? Because, the way that we speak in our native languages is different, and we want to honor what that means for folks. And so my answer is yes. Jillian is my partner in crime, so I don't want to speak for her, but absolutely something that I would love to see, and somebody that also is willing to bring their heart and their language to this.
No, yeah, definitely. Translation is one of those things that can be very tricky, because even if it is one language, so I'll just speak to Spanish, right? If it's one language, there's so many of us that speak different kinds of Spanish, and so how do you make that accessible, comfortable, and very user friendly? So I appreciate you, jumping into that role from a place of passion. So we'll go on to this other question that we got a little bit earlier from Ellen. Is there any way in our county to quote unquote catch people or families that might fall through the cracks and not be connected to an agency or not access these resources?
I think that's where partnership comes in, and why it's so important, and why every person in this room serves as a conduit to getting this information out there. We have our own kind of spheres in our worlds that we live in, not just professionally, but also personally. And so, we do partner, as Jillian mentioned before, with a lot of agencies that are going to help us get the word out. I personally sit on several health action committees that are also working in community, but I would love to see everybody that has this information to pass it on so that we can reach the unreachable folks. Because you're right, not everybody is going to have access to a social service agency. And we want to make sure that just as many folks as possible know that the system is out there. I hope that answered the question.
No, yes, definitely. I think those are really, really important points. So again, for folks, I know folks were kind of jumping in a little bit. So again, I want to reiterate, if anybody wants to ask a live question, please feel free to use the raise hand option or throw it in the Q&A section. Let's see, I had one more up here. It's going back to what we asked at the beginning in terms of the COVID-19 pandemic and the way it's impacted this tool. I know Jillian mentioned that it was something that kind of was a cause and effect, right? This happens, we need a response. And so I guess the question here would be like, is there still any kind of gaps that have been created? Because the other side of it is being able to kind of access these foods. And I did do the test run right now. And so I guess how do people know that it's safe, you know? Because I know, Monse, you mentioned that earlier, but in a different light, where you're talking about the safety that and anxiety people feel more so for immigration status. But now we have this added layer of anxiety with the pandemic. And, you know, how, I know this is just a part of it, but how is this tool able to maybe use language to kind of like answer that and maybe alleviate some of that anxiety? I think already there's a great way, because it just lists like this place is open. But is there anything added that you might want to work on in the future?
There are certain sites. In fact, I want to say quite a few of them that come up just depending on where you live that tell you, I mean, in terms of like safety for exposure to COVID, that will give you instructions like you have to wear a mask or a mask is required. Some are, you know, what we're calling this touchless system, where they ask you to open up your trunk and the food gets put in your trunk directly. And that is noted when you receive a text from from whatever particular resource that you're looking at. It will go through all of the steps or the requirements for that particular site. So in part, yes, we are definitely kind of addressing, and not us, it's really the providers that are giving that information so that folks, at least from that perspective, feel it's safe. But the other piece of that, and again, I keep hitting home with this partnership. If I give someone Text COMIDA as a resource and I'm a trusted resource, then that also helps to build trust as well. So that's why it's so valuable that as, you know, social service agencies or just individuals, that we are giving information that these are safe places. And more than likely you'll recognize what those distribution sites are. Santa Rosa obviously is a much bigger community, but think about the walking communities like Cloverdale and or Sonoma Valley. A lot of the resources that you're going to get are local churches and things like that. Mm-hmm. So not that it's not perfect, I wouldn't say that, and there is, I'm sure, you know, some things that you know we can do, but there's a lot of really good information on there to address some of what you just described.
Mm-hmm. Mm-hmm. No, definitely. And I think everything is kind of going in the right direction. And especially with what you mentioned, it's always that word of mouth, right? That really helps to alleviate that. Because if I hear it from, as well-meaning as someone might be, if I hear it just like on the street, you're like, oh, okay. But if, you know, my tia tells me, then I'm going to feel like, oh, okay, like it's more personal, right? So I love that. I love that you mentioned that. So let's see. We had, I think, one more question from Dr. Gonzalez. If not, I will.
Yes, actually, it's not a question. There are a couple of comments. One is the ISOCare is a group of people, volunteers, that was created by Dr. Para Lossi, that is a member of the faculty at Sutter Family Medicine Residency Program, and Tony Ramirez. And basically what happened is that they saw that when you are positive in the COVID test, you went home and you were isolated. And some of these people have no idea where to get food or other help. So basically this group is a volunteer, and we call the patient and ask them what they need. And then we connect them with hopefully mental health or food. And thank you, because this is an amazing source of help that you're dealing with. So that's ISOCare, and you can be volunteer, especially if you speak Spanish. I'm not sure if they are going to start with other languages like Southeast Asian languages, Laotian, Vietnamese, Cambodian. They might, because it's a population that will be affected. So that's ISOCare. I just want to tell you that in one of your polls, most users are anonymous, and there were been several studies showing that people feel very ashamed to ask for food. They feel that they are failure, and and I'm talking about white people. They said they interviewed them, and they said, "I never thought I would be in the line waiting for food." The other thing that I want to tell you is that when in a poll that you did, most people said that yes, they know where to get food when they need it. But that was our audience. That is professionals, well-educated. Most people that I know, my patients, this is an amazing program that will really help them because it's simple. They are not afraid of dialing the number and without telling their name. So I think it's an amazing program, and we really appreciate it. I think we reached the time of thank you very much to Lilian Merino and Montserrat and Jillian for your community work. This is so important. I know because I have patients, most of my patients are Latinos.